Let's talk of congenital uterine anomalies and what they really mean for fertility and pregnancy. So, when people hear they have got a heart shaped or a double womb, the first fear is often, will I ever be able to carry a baby? A recent scientific impact paper from the Royal College of Obstetricians and Gynecologists helps to answer this by putting the best evidence together. Let's start with how common the congenital uterine anomalies are. That differences in shape or structure that arise before birth. In a large meta analysis, about 5.5% of women in the general population had uterine anomalies. Among infertile women, it was 8%. In women with miscarriage, 13.3%, and those who had both infertility and miscarriage, almost a quarter of 24.5% had an anomaly. But not all anomalies act the same. One key group is canalization defect, especially septate uterus, where the wall divides the cavity. These women have roughly 3 times the odds of having a first trimester miscarriage, about twice the risk of preterm births, and around 6 times the risk that the baby will be breech or not head down position at delivery. So that's again a septate uterus. Another group of unification defects, which basically means that when two of the horns combine, and that's a unification defect. So when it's a heart shaped, could be a bicornuate or a unicornuate uterus that does not block conception, but does increase miscarriage, preterm, and malpresentation. How do we find these anomalies? In the past, women needed a laparoscopy and hysteroscopy, two invasive procedures. Now, three-dimensional ultrasound, most of the heavy lifting takes place, showing both the outer and inner cavity in a single coronal view. MRI also is useful and more accurate and will tell us in complex cases. What is the big controversy? For women with functional rudimentary horn causing pain or risk of pregnancy, that horn removal is reasonable or beneficial. For non-obstructive anomalies, especially septate uterus, many centers offer a hysteroscopic resection, cutting the septum through a scope pass through the cervix. Observational studies suggest reduction in miscarriage. A meta-analysis found that the combined risk of first trimester and second trimester miscarriage dropped by about a third after surgery. We don't have large definitive randomized controlled trials showing better overall live birth rates or less preterm. But once it's tried, the trust study is in progress. So what is the take-home message? Most women with these anomalies have healthy pregnancy. The key is precise diagnosis, honest discussion about risk, careful pregnancy monitoring, especially for preterm and growth problems. If you do find a uterine anomaly on an ultrasound scan or a suspicion, have a think what we can do.